Thank you, Madam Speaker. The Ministry of Health is keenly aware of the strategic value of health to the Dominican society. Without good health, our population, workforce, education, and general quality of life are severely compromised. In good health, we are able to accomplish all tasks necessary for our society to flourish and grow. Therefore, the Ministry of Health is continuously focused on ensuring our populations has access to health care and information that can enhance well-being and quality of life. The Ministry of Health plays a critical role in maintaining and enhancing the social land space in the country. With this aim, we are diligently providing the necessary preventive, curative, and rehabilitative health care that is affordable and sustainable. We also seek to empower persons living in Dominica to better manage their own health, improve their productivity, and reduce the risk for disease and injury in the most cost-effective way. Madam Speaker, there have been significant achievements within the Ministry of Health during the fiscal year under review. The many improvements in healthcare, access, equipment, and education are evidence of a proactive stance towards the health of our nation. Some of the gains that we celebrate today have been built on the foundation of a strong primary healthcare system for which Dominica has received international recognition and used as a model for the other Caribbean countries. Ministry of Health continues its focus on the prevention of CNCDs and other major health issues in keeping with government's broad policy framework and strategic direction guided by the Growth and Social Protection Strategy. We are guided by the overarching responsibility and recognition that the health of the nation is the wealth of the nation. Physical infrastructure. Madam Speaker, the physical infrastructure of our health centers is of crucial importance as the foundation from which modern healthcare services can be delivered. This year saw significant rehabilitation works at the Princess Margaret Hospital as we undertook repairs to the old psychiatric unit. There was an urgent need to alleviate the cramped conditions that existed in the current outpatient clinic section of the Louis Pasteur Polyclinic. This restructure was completed with great speed to avoid inconvenience to users of the system and is now a greatly enhanced area of the hospital, which benefits both staff and patients. The cost of completing the ground floor was $707,000. To date, the total cost incurred for renovating the entire building is $1.6 million. Other minor works required for basic maintenance of the facilities continue to be carried out at the hospital. However, a new construction for the hospital was also a major area of focus for the Ministry of Health during this financial year. A team of Chinese technicians visited the island to to present a concept design for the new hospital project. A request for technical assistance was subsequently submitted to PAHU. This technical support was required to review the design proposal and prepare a design counter proposal, and a team of consultants have provided support in this regard. Under the project for repairs to health centers, the ministry has undertaken one major health center renovation this year, which occurred at the Fonkole Health Center. The rehabilitation of this health center has greatly enhanced its functionality, safety, and aesthetics. The total cost of the project was approximated $321,000. A continuation of this rehabilitation work will continue at other health centers throughout the island. Renovations to the children's dental unit at the Roseau Health Center has become completed at a cost of $66,000. To reduce waiting time at the Accident and Emergency Department at the Princess Margaret Hospital, the Ministry of Health has begun a pilot program of extended hours of service at the health centers in the surrounding communities of Roseau. A temporary accident and emergency department has been completed at the Marigot Hospital, whilst plans for a major upgrade are underway. A draft proposal has been prepared for review and commence, and a budget sum of $100,000 has been allocated for minor remedial works and to engage in preliminary activity for the hospital. The renovation of the Marigot Hospital is of paramount importance for the Ministry of Health. The hospital is a valuable lifeline of health care for the residents of the Marigot Hospital and surrounding areas. In addition, the hospital must be prepared to have services available for the newly upgraded and extended Melville Hall Airport. A modern, well-equipped hospital in this northern district is in keeping with the ministry's strategic plan to significantly decentralize its health care services. Other works planned for this financial year include completion of renovation works at the St. Joseph Health Center, refurbishing work at the Casabruce, Saint-Sauveur, and Maho River Health Centers, continuation of works at the Roseau Health Center, including design and construction of appropriate storm drains, major renovations to the Portsmouth Hospital, which will cost approximately $675,000. This consists of $500,000 from government and a grant of $175,000 from Ross University and the Rotary Club. Roof repairs are to be done at the Dubla Health Center at a cost of $210,000. Major electrical and plumbing repairs will be completed at various health centers, including the Casabruce Health Center, Marigot Hospital, Grand Fort Health Center, Bagatelle Health Center. Purchase of equipment. Madam Speaker, in addition to improving the physical infrastructure of our healthcare buildings, the Ministry of Health has invested in the equipment necessary to provide high-quality diagnosis and treatment options for patients. Many of these pieces of equipment were previously unavailable in Dominica. By obtaining these tools, we now enable our population to have access to treatments that were formerly accessible only by traveling overseas. During 2013-2014, approximately $3 million was spent on new equipment, including a new updated Toshiba CT scan machine was procured at a cost of $1 million. This machine will assist with the diagnosis of medical conditions and planning for radiotherapy and biopsies. Provision of such services to the public commenced on May 19th here. A digital mammogram machine purchased at a cost of $718,000 is being utilized to assist in examining breast tissue for the diagnosis of breast cancer. This complements the new oncology unit at the hospital, which facilitates the provision of services to patients suffering from cancer. Gastroscopy colonoscopy system was procured at a cost of $226,000. It is providing opportunities for the diagnosis of abnormalities within the intestinal tract. Gastrointestinal cancer is one of the top 3 malignancies in Dominica, and this equipment, being the gold standard for screening and early diagnosis, will lead to improved prognosis for patients. The orthopedic unit has been equipped with resources which includes drills, saws, screws, and pins. Supplies totaling a cost of over $200,000 are now being used to facilitate surgeries involving bones at significantly reduced fees as compared to those performed overseas. The Ministry of Health is also in the process of reviewing various MRI machine types and contracts to determine what is best to purchase. A US-based Dominican consultant physician has facilitated the procurement of an echo machine, which assists with the effective diagnosis of abnormalities in the heart. A technician experienced in performing echo examinations has been employed, and regular echo clinics are now being held at the Princess Margaret Hospital. Human resource development. Even with the best of infrastructure and equipment, the healthcare system can only function and deliver services through its human resource capacity. The Ministry of Health is committed to the training of staff, creating new positions where necessary, and working with interns and overseas professionals. The Ministry of Health has facilitated the training of 5 medical doctors in various specialist fields, including oncology, orthopedic surgery, infectious disease, epidemiology, and internal medicine. Government-assisted training of nurses in several specialized graduate and postgraduate areas, including critical care nursing, family nurse practitioner, community health nursing, operating theater nursing, laboratory, and counseling. 22 nurses completed training with certificates in midwifery. The past year also witnessed an increase in tertiary care services from visiting specialists. For example, a vascular surgeon has been inserting fistulas for dialysis patients at half the cost that they would pay overseas. Adult and pediatric cardiologists are providing services to patients with heart problems. In January 2014, the Ministry of Health also benefited from the employment of 27 interns from the National Employment Program in the areas of dental health, optometry, biomedical technology, ICT, nutrition, public health, laboratory, environmental health, and vector control, among others. A cardiothoracic surgeon has been holding specialist clinics for patients with heart-related problems such as heart murmurs. PMH medical specialists have expanded their services by having specialist clinics at the primary health care level, that is, in all the districts. Ophthalmology and psychiatric clinics continue to be provided in the districts, and surgical clinics, which was first introduced in 2013, continues to be a success as early screening and diagnosis is facilitated by surgeon visits to the outdistricts. We have commenced a pharmacy training program at the Dominica State College. Infant mortality and pediatric care. Madam Speaker, the Ministry of Health is committed to providing high-quality services for the most fragile and dependent members of our population, namely newborn infants and young children. In this regard, the government plans to reduce infant mortality. The Ministry of Health is working to improve the quality of its birth database. This will provide improved monitoring of the coverage and outcomes of primary health care interventions. The Ministry of Health is dedicated to the improvement in care for newborn infants and children, and is currently undertaking the implementation of steps towards the reduction of neonatal infant mortality through the European Union-funded Dominica Reduction in Infant Mortality Project. This includes procurement of much-needed equipment such as neonatal ventilators and incubators, physical enhancement of the maternal and neonatal units, training of staff, and implementation of controlled training programs and measures. Total expenditure for this program for 2013-2014 was $780,000. The Ministry of Health has facilitated the organization of 2 referral clinics annually in cardiology and neurology with our French colleagues. These clinics have allowed access to hundreds of thousands of dollars in medical care and improvement in quality of life, as well as survival of many of our children. The partnership with the International Children's Hospital in St. Vincent and the US also provides some specialized pediatric services. The government of Dominica provides subsidies for travel for children referred under the program. These services are free of charge to anyone under 21 years. The National HIV/AIDS Response Program. Madam Speaker, the impact of HIV and AIDS is always a matter of priority for the Ministry of Health. Recently, a 2-day consultation took place to sensitize stakeholders on the HIV/AIDS strategic plan to mitigate the negative impacts of HIV in Dominica. This important meeting has brought about Dominican's national strategic plan for HIV/AIDS for 2015 to 2019. The HIV unit has had many achievements over the past year, including the establishment of testing and counseling services with the introduction of on-site rapid testing, where persons are able to access testing and have a 45-minute turnaround time for results. All 7 health districts can provide rapid testing as well as an NGO, that is the DPPA, a treatment program for persons living with HIV, prevention education programs with community outreach. Through the commitment of some donor agencies, support for stigma and discrimination to include policy development has become a reality. Support of the existing program through budget year 2014 to 2015 is a must. The national policy is in the final draft and ready to be submitted to Cabinet. With the dwindling of global funds by 2015, government has prepared for the treatment of HIV/AIDS patients. Diabetes. Madam Speaker, the issue of diabetes has been of prime importance to the ministry. For the last few years, we have been providing services and sensitization aimed at decreasing the number of amputations which can occur as a result of the disease. In October 2013, we announced a significant decrease in amputations. Only 7 occurred in that year, compared with 36 in 2011 and 27 in 2012. Therefore, the statistics show clearly a decline that has been as a result of government's intervention and healthcare providence. We shall continue to work on this until we have reduced the number of annual amputations through diabetes to 0. Diabetic foot clinics have been instituted in all health districts. Our teams of nurses and primary healthcare professionals have heightened awareness on how to prevent diabetic foot disease and contributed to the growing awareness of the importance of caring for the feet. Photofundoscopy clinics are now a regular feature of diabetic clinics in order to assist diagnosis of diabetic retinopathy, which can occur as a result of diabetes. This vigilant treatment and monitoring of the eyes can prevent blindness in diabetic patients. Cancer. Madam Speaker, the incidence of cancer in Dominica is responsible for 20% of total deaths. Significant measures have been put in place to make improvements to the diagnosis and treatment facilities now available on island. Early intervention. Breast examinations have been conducted in all the health districts, with the services of the district nurses being augmented by the nurse educator attached to the Cancer Society, who was at the same time working in the health promotion unit of the Ministry of Health. Mammograms, which are the next step should a woman discover a lump in her breast, are available at reasonable cost at the Princess Margaret Hospital. The installation of the new CT scan means that the cancer patients can access a CT scan for $500 rather than paying for themselves and a caregiver to go to another island at the expense of over $5,000. The installation of the MRI machine, which is expected this year, will result in further savings for these patients. Cervical pap smear testing has been long available free in the health districts. In this, Dominica is way ahead of some other Caribbean territory. You may have heard of the online petition found at www.endcervicalcancernow.org, where governments across the region are called on to provide free pap smear testing. Dominica signed this petition, even though we are already way ahead of the game in this regard. In addition to our ongoing efforts, the district medical teams welcome the initiatives of the Dominica Cancer Society to train some 60 community advocates to encourage women to take an annual pap smear and to provide support to those with an abnormal result or those undergoing surgical intervention. This program was funded in the amount of $5,000 by the Australian High Commission as part of the regional program facilitated by the Healthy Caribbean Coalition. Responding quickly to evidence in pap smears of precancerous cells can render the patient free of cancer. Cervical cancer is slow growing, and so treatment usually has positive outcomes. However, early intervention is crucial, and waiting times for diagnostic tests and biopsy must be cut to a minimum. The Healthy Caribbean Coalition program has paid for 60 colposcopies for those referred to hospital following a pap smear. Treatment. The Dominica Cancer Society has urged us to ensure that the general public are aware that many cancer treatment services are available in the public system, and there is often no need to go overseas for treatment. After surgery for cancer, patients are referred to the newly established oncology department, where they will be started on chemotherapy. The usual program for treatment is 4 to 6 cycles of chemotherapy. This costs $1,000 per cycle. However, with current subsidies, patients are paying between $500 and $800 per cycle. Where patients have a welfare card, the chemo is provided free of charge. The oncology department is staffed by a volunteer, highly experienced oncologist, Dr. Kamal Malaka, and 2 devoted nurses. This team conducted 178 patients' appointments in the clinics in the first quarter of 2014. This voluntary arrangement, whereby the patients benefit from being the subjects of the clinical tuition sessions for Ross Medical School, has proved beneficial. However, by the end of 2015, our own trained Dr. Martin should return from Jamaica to continue with the program. So this year has been of tremendous progress, and there are ongoing endeavors to continually improve upon these services and ensure that patients with cancer receive the utmost care, treatment, and support. Dental care. Madam Speaker, during the period under review, the dental unit has made significant strides. There has been an increase in the number of clients seen and treated, particularly in the Roseau catchment. 2 dental surgeons are currently being employed to assist with the shortage of staff and to provide continuous service to the public. Under the National Employment Program, the unit has benefited tremendously with 3 young people who were assigned to the department. For the first time, a secretary was assigned to the chief dental officer. A dental assistant and dental hygienist were also assigned to the unit. The workload in the department has been alleviated with the presence of these interns. In an effort to improve the quality of service to the public, we have procured 7 dental compressors at a cost of $67,000 to be installed in the dental clinics throughout the island. Health promotion. The focus in the health promotion unit has been on the reduction of risk factors to NCDs through health promotion strategies. The department has been able to strengthen collaboration with both the public sector and civil society. This includes corporate organizations and health NGOs. Dominica has reduced the affordability of tobacco products by implementing increased taxes of 75% to all tobacco products. A school health and nutrition policy and a plan of action for obesity reduction in school will soon be implemented. Implementation of a month of activities with broad multi-stakeholder involvement for Caribbean Wellness Day and the observance of other international health days. public awareness and workplace programs on diet and physical activity, implementation program to decrease the prevalence and incidence of anemia in the Laplain Health District, conducted in collaboration with the Agricultural Extension Unit. Environmental health and solid waste. Madam Speaker, the environmental health departments have made significant strides within the last fiscal period. The National Solid Waste Management Guidelines for Environmental Health has been completed utilizing stakeholder approach. These guidelines will provide the standards for the management of solid waste in the island for the next decade. Additional measures include National Food Safety Guidelines for Environmental Health has been completed. The draft National Occupational Health and Safety Guidelines for the construction industry are at the early stages of development. The draft Environmental Health Policy is 50% completed. Draft Food Hygiene Regulations under the Environmental Health Services Act number 8 of 1997 was reviewed. This regulation is required for the license of food businesses on island, which will lead to the promotion of food safety and the prevention of food-borne diseases. A national chikungunya emergency plan has been developed. Since the first reported case in December 2013, extensive health promotion focusing on preventive measures for this disease have been widely circulated throughout the media. The public is urged to take responsibility for reducing the rate of infection. The Dominica Solid Waste Corporation has achieved the following. The Dominica Solid Waste Management Corporation and the Japanese Embassy in Trinidad and Tobago signed an agreement for the purchase of a specialized garbage truck for the collection of recyclable waste on island. The corporation launched an advanced reduce, reuse, and recyclable initiative program for the Goodwill Primary School. Building on the garbage sheds on the West Coast and partnering with a number of communities and groups in the construction of garbage sheds around the island. Construction of a shed and landfill with the assistance from the state prison for the housing of the plastic shredding plant. Construction of building at landfill for the processing of biodiesel using cooking oil. Collection of recyclable waste in the Atlantic communities of the island. Urban renewal. Madam Speaker, in the Ministry of Health, focus on urban renewal, a variety of projects are either underway or have been successfully completed. The Tarish Pit retaining wall has been a concern for the ministry to secure the safety of persons living in the area, which is beginning to slide during heavy rains and inclement weather. Plans to construct a portion of the wall each year over a 5-year period at a cost of $250,000 per section will provide security for the area, while also providing short-term employment to members of that community. The State House is now complete and currently provides housing and office space for the President of the Commonwealth of Dominica. The conference room, with a capacity of 200 persons, which is part of the project, is ready for use for state and other functions. The electoral office is now housed in new offices which provide adequate space for staff operations and the preparation and storage of ballot activity documents. There is a large meeting room where training sessions can be held and other staff and district matters can be addressed. The building is also shared by the Public and Police Services and the Integrity Commission. Housing projects have been initiated in Bafa State and Emzor and are well on the way. Focus for the next fiscal year. While we made significant strides in health, the Ministry of Health is determined to create the environment for enhanced and quality health services for all Dominicans. We will continue to renovate our health facilities, particularly in the primary healthcare area. Purchase and provide the necessary equipment and machinery needed to decrease the number of persons for overseas travel for medical care, thereby making healthcare affordable and accessible to our people. We are indeed proud of our recent improvements in care for cancer patients and will continue to enhance the partnership with the Dominica Cancer Society. The government of Dominica, through grant funding from the People's Republic of China, is continuing its plans to construct a new state-of-the-art hospital. We have had several consultations with our technical persons, including our doctors, our heads of department, our public works engineers and architects, and all other stakeholders. There are those who stay outside and are so full of themselves, Madam Speaker, who criticize in the papers. We will go on without them. Maybe they do not have anything to offer anyway, based on what they are producing in the papers. The implementation of free eye screening program for primary and secondary schools will commence in August 2014. There are also major policy documents and guidelines to be completed and implemented, including implementation of national medicines policy, electronic tendering system for the OECS PPS countries, revision and completion legislation, including pharmacy, nursing, and environmental health, computerization of inventory system for the pharmacies, the national food policy, health and safety policy, the national HIV policy, addition of new medicines to the formulary, the visit this month of an ophthalmological team from China who will perform free cataract operations to some 100 Dominicans. They are providing state-of-the-art equipment for their services, and all the equipment is to remain in Dominica. Major projects in Roseau North constituency. It is quite apparent that the government of the Commonwealth of Dominica continues to work towards the development and improved quality of life of every Dominican. The Roseau North constituency is no. For this year, there has been a buzz going around. The undertaking of major projects continue throughout the length and breadth of the Roseau North constituency. Some of those projects include major roadworks at Yampis, including drainage and retaining wall to the extent of $500,000. As a result, the residents can boast and appreciate the enhanced gateway to the community. Residents of Stock Farm can now breathe a sigh of relief in what was once considered a nightmare, that is, passing over a 2-foot wide precipice to traverse in the area. This is now a safe, motorable road. This is expected to cost some $200,000. Also in that area is the resurfacing with concrete of some 200 yards of road. Of course, housing continues to be a serious concern in the Roseau North constituency. Hence, the allocation of building of 10 petrol casas, 9 in Stock Farm and 1 in Belvirol, and several miscellaneous projects in the Stock Farm and Yampis area. However, the entire constituency has benefited from the housing repairs, including Fonkole, Belvirol, Goodwill, Stock Farm, Tarish Pit, Yampis, and Pottersville. Recognizing that this is the largest constituency in the island, there is still much work to be done. Dan O'Brien, an Olympic gold medalist, said, "Sports gives us the ability to test ourselves mentally, physically, and emotionally in a way no other aspect of life can. For many of us who struggle with fitting in our identity, sport gives us first face of confidence. That bit of confidence can be a gateway to many other great things. That is why we have seen it fit to light up the Tarish Pit playing field to give access to our youth. We are also assisting the Dominica Football Association with the dismantling of the stands of the old stadium to the Goal 2 project. Similarly, we are assisting with the clearing, upgrading, and maintenance of the Louisville playing field. At Fonkole, there was major roadworks at the foot of the main hill, widening the entire area and removal of all the hazards with improved drainage and constructing footpaths in that area. Major roadworks in Upper Glasgow, resulting in the concrete paving of some 500 yards of road, is now underway. The residents there are absolutely elated with the construction. Clearly, the jewel of the crown of the projects would be the construction of the new Dominica State College. The goal of this administration is to ensure that every household in Dominica has one university graduate. This will be a remarkable achievement for Dominica, and the college expansion and modernization will make sure this is a reality, as this will help citizens from migrating in order to obtain university degrees. Steps and proper drainage was built at the back of the Princess Margaret Hospital to accommodate the people of Gutter Extension, because the footpath which they traversed was difficult during heavy rains and at nights. So, Madam Speaker, when opposition parties have mock debates at Arawak House of Culture, you know, Madam Speaker, we witnessed a situation whereby the leader of the United Workers' Party was saying all along that another gentleman of his party is going to the Minister of Finance. However, he was the one at the Arawak. He was reading, and he said he produced a budget for Dominica. He has no local standby, because he is not, according to him, going to be the Minister of Finance. And what makes it even worse was the leader of the opposition came in this house and he just made just a total mess of his opportunity to deal with the budget. So, Madam Speaker, when they talk about change, we are the change, Madam Speaker. We, this Dominica Labour Party, we are the change. We are showing by building of a new state-of-the-art hospital in Goodwill. The new hospital will be...
You have 4 minutes left.
Yeah, just 5 minutes. Yeah, just 5 minutes. Okay.
Madam Speaker, I move that the Minister be given 10 more minutes for the completion of his presentation. Thank you.
Second it, Madam Speaker.
Sorry about that. It has been moved and seconded that this was not on, that the Minister get a further 10 minutes to complete his presentation. Those in favor? Aye. Those against? The ayes have it. Please continue.
So, Madam Speaker, the new hospital will be equipped with modern beds, new state-of-the-art equipment, and we are also training new specialists to complement the structure. Madam Speaker, the building of the conference center at the Princess Margaret Hospital with video conferencing facilities. Madam Speaker, when we talk about change, we are providing oncology services now in pristine and modern surroundings. Madam Speaker, when we talk about change, the Prime Minister, in his budget presentation, said we will be providing modern indoor sport facilities at Stock Farm to complement the Goal 2 project to accommodate volleyball, basketball, netball, and other indoor sport. This will enable the area with an extended car park of the Dominica State College to be able to host other activities like World Creole Music Festival, Calypso Finals, and other concerts. Madam Speaker, when we talk about change, Madam Speaker, my goal is to remove the prison from its present location and to construct a 400-meter tract where the old landfill was area. Madam Speaker, when we talk about change, to construct the new Goodwill Secondary School and to upgrade the playing field to international football standards. These are some of the projects which we intend to continue and pursue in the Roseau North constituency in the next few years. So, Madam Speaker, I say, give Dominica a chance, Madam Speaker. Give Dominica a chance. Even though the opposition opposes everything that arises for Dominica to develop, Dominicans are blessed to have a Prime Minister who thinks otherwise and has proven that our natural conservation must go hand in hand with modernization. Madam Speaker, they did not want the Emsall Road. Look how beautiful it is, Madam Speaker, right next to the university. They said that the Bath Estate Bridge was coming from nowhere to nowhere. They said that the Bath Road Bridge and road could not go up to Goodwill. The Santa Roma Road, they said it could not be widened. The Hanover Street Bridge to Elliott Avenue was a waste of money. They also said that night landing was not feasible, and the list goes on and on. I remember, Madam Speaker, a member of this team once told me that if diamonds were found at the foot of Mont Diablotin, we could not go and extract it. Well, Madam Speaker, we are continuing with our commitments. One, to ensure that Roseau and Portsmouth will be modernized with all roads being redone with proper sidewalk. That the Botanical Gardens Bypass Road will be built. The entire city and town areas, including all the bridges, will be properly lit, and the West Bridge in Roseau will be upgraded. Madam Speaker, an international airport is on the cards. At least 3 major hotels are to be built. Madam Speaker, geothermal energy will be exploited so that Dominica can take its place as leader in development, so that high-end jobs can be obtained and our educated men and women will want to remain in Dominica. And we can, that way, will assist us to have population growth and the other economies of scale. So, Madam Speaker, it is very, very clear from this budget, and what I said, Madam Speaker, we are the change, and we ask that they give Dominica a chance to develop. Thank you very much.